Hey guys, this is Dr. Sandy with another exciting video for you and your family and friends. So today we're actually going to talk about a serious issue, which is headaches and migraines. I'm calling this video 101, just kind of like the fundamentals, like what are headaches and migraines, what are triggers, and what are options to deal with them. If you're new to this video, welcome. My name is Dr. Sandy. I'm going to my 24th year as a chiropractor. Me and my team have been blessed winning multiple awards because we consistently help our patients, we serve our patients well, we treat them with respect, and we are honored to help people. Our mission is just to improve the quality of life of every single person we meet. So let's jump into today's topic. So headaches and migraines. If you're listening to this and you suffer with them, or you have a family member or friend who suffers with them, you already know, depending on the severity, I mean, this can be quite debilitating. So on the low end, there's some people who might get a headache, once a year. They didn't sleep enough. They didn't eat the right foods. It's, hardly an issue, not a big deal. They're going on with their life. Not, like I said, maybe once a year. And then you have the other extreme. Then you have people where, it's a regular occurrence. It's happening maybe weekly, hopefully not daily, but in some cases it can get that bad. And now these people, it's really affecting their quality of life. So if they're a student, definitely affecting their ability to focus and concentrate. It's interrupting their school life. If someone's an adult, professional, working, they might be missing days of work, maybe taking some time off consistently, which is not good. And even if they have the pain, they might manage, they might push through, but it's definitely affecting quality of life. And I think the big thing too is it can really affect the family life. If it gets bad enough, maybe you can't go out to a certain party that night, or you miss certain events, or just going for simple things like a walk together. You can't because your family member is not feeling good. They have those headaches and migraines. So there's a lot of literature on headaches and migraines, and I'll give you my interpretation. So headaches to me are obviously uncomfortable. They do affect quality of life. But to me, if I look at a spectrum, I feel like migraines are like the very extreme of that. Like the intensity is stronger. Someone with a migraine history might say that, they need to dim the lights, no sound. And it's like sometimes it can be like a crushing type pain. And sometimes they'll feel nauseous or actually vomit. So to me, it's like a spectrum. And then from there, it can lead to other things like obviously drained energy. You don't want to do anything. It just affects so many things. So, and I guess another thing too, I've been in practice for years now, and I find it interesting. Some people who suffer with headaches and migraines, they kind of think like, well, that's just normal. So sometimes we'll ask people about a history, and they'll you can tell from their tone, they're kind of like, yeah, like, I get headaches like everyone else, like 2-3 times a week. And I always pause and I try to let them know that that is not normal. Like, you shouldn't be getting regular headaches like that. So there's something that we have to look at. And again, we are all about quality of life in our office. We want to make sure people are enjoying, not just getting by and pushing through, but really getting the most out of life and living at the highest level. So when we look at it, headaches and migraines and any type of pressure that there's different patterns. There's patterns where it can show up in the back of the head, the front, that may be more with sinuses. Tension headaches might be more on the side. You can have like pressure pain, sharp pain, poking pain going into the eyes. It can be very uncomfortable. So there can be different zones. Maybe it's just at the top, as I mentioned, the sides, back. You may have numbness or tingling in certain regions. It might be half of the face or the other side of the face. It can be very, very frustrating and painful. And what are some of the things that may contribute to that? So number one, I would say probably one of the biggest ones would be high levels of chronic stress. So when you're chronically under stress, the system is overstimulated, so the nerves are irritated and inflamed, the muscles start to contract, the biomechanics start to shift in the spine, and that can lead to headaches and migraines. And if you talk to a lot of people who have headaches and migraines, they'll usually tell you a big trigger is if they get stressed. If things get too hectic, busy, if they're worried about something, it can actually be a trigger for that. The other thing as well is that posture can definitely affect it. So we live in a time where, like we have tons of technology. We have a lot of people who are working on computers, and then to take a break, they use their phone. So we see a lot of people in that hunched position. Students who are studying and then to take a break, they might gain. So we're seeing a lot of postural related issues as well. And then of course, diet. There might be certain foods you have that trigger it, that cause headaches and migraines. And it's something like, you want to definitely be mindful of. So what are some things we can do to help? Now, as a chiropractor, what I would say professionally is that there is absolutely a time where, drugs, medication may be necessary. I feel, in my opinion, in extreme cases. And while we may use that tool to bridge the gap because it's too overbearing, we can't function, I respect that. I think as a doctor in healthcare, we should always be saying, okay, what's the root cause of it? Maybe we need these, medications temporarily. And the thing is, a lot of these medications, I mean, we all know this, like, while they can help in certain situations, they carry side effects, and we always have to weigh, the benefits and the pros and cons and all those things. And we should just be, anything going into our body, we should be mindful, and we respect those tools. But I believe if we can go natural, if we can go with something that's actually getting to the root cause, I think that's the way we should go. So number one, if we look at some natural options, so maybe if you are having some irritation or headaches or migraines, you may want to look at putting a cold towel or an ice pack. Probably when I would avoid this in the opposite situation, if it feels it's more sinus related, you may want to put heat in those areas. But see if maybe cold or hot. Cold would be for that severe pain. You can put it there. Again, start with a cold towel. If it's very strong, you can use an ice pack. But if you feel it's sinus related, you may gently just want to put a warm cloth where you feel that pressure with the sinuses. If you feel it maybe even coming maybe from the shoulder area, again, you may want to put some ice or heat along these areas over here. Another thing obviously is stretching. So anytime we can keep mobility in the spine, that's going to be a positive. So if you feel like you're very tense, if you haven't been moving much, you're kind of stuck in one position. So making that time every hour to take a break, and then very gently, the major one would be going back, because that's opposite of obviously, being on a computer all day. So we want to go back. Even if you can hold for a few seconds, you can do this even seated. I love this one where you go side to side. Just try holding for a few seconds, obviously seeing if you're comfortable. Only do what's comfortable. And then obviously if you could just, and I like to not only turn the neck, I like to get my whole body into it, but just turning side to side. So some stretches like that may help also take the pressure off. Obviously I would suggest drinking water, so hydrating that system at the top. So this is called your cervical spine, which is also known as the neck. But hydration is obviously a good thing you can look at as well. You may want to look at your sleep schedule. Are you getting enough rest? That's a big one as well. You may want to look at things like alcohol, caffeine, being mindful that, maybe when you have alcohol, does it trigger a certain response? Is caffeine triggering response, too much caffeine? And even people who miss caffeine, sometimes they get a withdrawal headache. But being mindful and saying, okay, why does my body need the caffeine then? Like, why am, drinking a caffeinated beverage should just be, not something you're addicted to. But if you feel you miss it and you get a headache, I would suggest it's something you should work on. It's something you should be mindful of, that, like, why am I missing a tea or coffee and it's producing a headache? Like, that should not be happening. So I think something you have to look into. Obviously, keeping a food journal. Maybe there's certain foods that you're eating, meals that you're having, lack of meals. So, there's the whole diet aspect, hydration aspect you want to look at, your sleep schedule. Are you getting enough rest? When do you sleep? Stretching. We mentioned using also the ice, the heat, and things like that. I would also recommend meditating, breathing exercises, just taking that time to relax, to kind of disconnect and give your mind and body a chance to rest. I think that would be critical as well. And the big thing I really want to share with you today is the power of chiropractic and a proper alignment in the spine. So I actually have spine right here. So when we look at things like headaches and migraines, what we're looking for is, we're looking at this top area, and you can see, and this is very simplified obviously, but we're looking through this top area. You can see, I'm going to say the color violet, this represents your cervical spine. And if there's any type of misalignment, like there's a shift over here, and this could be from chronic stress, You might even be having headaches and migraines possibly due to a slip, fall, or trauma. But if this has shifted and it's irritating, compressing, inflaming those nerves, that can also contribute to headaches and migraine type symptoms. So in chiropractic, what we want to do is first assess the system, see if there is any type of misalignments causing dysfunction, causing problems, causing headaches and migraines. We assess it first to see if it's that issue, and then very gently we work on getting that back in place and retraining it. Now, I want to give you a frame of reference as well. If someone comes to our clinic and they've had headaches and migraines for 20, 30 years, it's obviously going to take time. This is not that, they get the one session and everything's been cleared. It's going to take time. It's a training thing. Another thing is the lifestyle. So I could have two people come to me with headaches and migraines who are 50 years old. And if one is eating well, sleeping well, they exercise, don't have much stress, they will heal faster. Someone who comes to us with the same age is a smoker, drinks alcohol under high stress, they'll probably take longer to respond. They may get good results, but maybe not to the same level because there's added stress on that system. So we have to be aware of all those things. Another thing is age, as I mentioned. So if someone comes to us at 25 with headaches and migraines, their body, because they're still young, it can rejuvenate and heal faster. Will make a huge impact on their results. They'll respond better than, again, someone who's 50 with the same symptoms. They'll probably take longer. Why? They've probably had those misalignments longer. They're probably under more chronic stress. And again, we in chiropractic would assess this and then very gently finding which segment is blocked. We want to make that difference. We want to take that pressure off so the nerve function can go to the brain, can go to the skin, even literally at the top, can go into the different muscle groups and balance. Chiropractic, honestly, if I had to summarize it in one word, it's about balance. It's about harmony. It's just about bringing things right. That's why we use the word adjustment. So we want to gently get it in place. And here's the thing. You might be listening to this or for yourself or someone you care about, and maybe you do use ice and heat. Maybe sometimes you use medication. You drink water and it does help. But my question to you is that, let's say someone has this misalignment, so they drink water, they do their exercises, and they feel better and it comes back. Until you get that properly aligned, whatever segment that is at, it's going to keep coming back, and it really shouldn't be. And even sometimes if someone's had it for a long time, we've helped patients where there's been resolution. We've had patients where maybe they're 80% better because they've had it for so long. Or maybe it's a situation where they're like, you know what, Dr. Sandy, I've had these headaches like several times a week. Now it's several times a month. So maybe it's not eliminated, but if we saw them sooner, we would have got better results. But the frequency is less or the intensity is less. So they might say, I get those headaches, a couple of times a month, but the good thing is they're just less intense. I can still function. If I just rest a bit, I'm good. It doesn't stop my complete day. But always remember the key thing also in healthcare, it's all about speed. It's about taking action. So if you're suffering with something, take steps in the early stages. Don't wait for it to get worse because then it's harder to resolve. The success rate will not be as strong. So when you have smaller symptoms, take action on it, get it assessed, and then you can be feeling more confident that you'll get better results. But if you wait and it's chronic, there's been a lot of breakdown, it's harder to see the results. They probably won't be as strong. And that's not the way to live. Because as I said before too, our whole obsession in chiropractic, and at least for me personally too, I want everyone to have that high quality of life, good quality of life, living natural, respecting, yes, that sometimes we need those medications, but if we can try to find a natural way to function better, get to the root cause. Because here's the thing too, when you have headaches and migraines, it can affect your focus, it affects your mood, your ability to function. We want to have a healthy spine so the brain can function well, the body can feel well. And think about when you're aligning that system, what are the benefits? So it's helping the neurology so the nerves can work better. Circulation will improve, more oxygen to your brain. The mechanics are better. So when you have a healthy spine in alignment, it's not grinding the joint, it's not degenerating. So a healthy alignment is actually keeping the system strong. It's keeping that pipeline strong between brain and body. So you're helping the mechanics, you're helping circulation, you're helping neurology. There's so many benefits to having a healthy spine, especially at the top, and it can have a huge impact in helping with headaches and migraines. So if you're listening to this, if you'd like to take action, we would love to do a checkup. And if you text or call, it's at 905-896-3393. Even if you just have some questions, we're here for you. We'll try to help as much as we can. But again, our number is 905-896-3393. I hope this educated you. I hope this brought you some knowledge about headaches and migraines. And I'll be honest, I would love to work with you. And whether it's me or someone else, if you're suffering with headaches and migraine, it's been long enough, seek professional help, get someone to help you, whatever works for you. But you don't deserve to suffer. You deserve the best life possible. So God bless you. This is Dr. Sandy signing off.